You make me weak in the knees.
Hey, Remarkable Lifers, this is Craig.
And this is KJ.
And today we're going to talk about emergency knee surgery in Mexico. Let's get started. We're going to talk about the last couple of weeks. So there's a history here. The last, what do you think, about a couple of
Years?
Yeah. Probably last year at least. I've been having a lot of problems with my knee. Couldn't go to the gym. When I did go to the gym, I could only do upper body. My poor trainer, he was just so frustrated. He wanted me to do legs, and I'm like, no.
Well, it was always like hit and miss, too. It was
Yeah.
like sometimes you were fine for weeks and weeks and weeks, and then, it's just one of those things,
Yep.
you start getting older, and you're like, oh, that happens.
I guess that hurts now.
I
yeah.
guess that hurts now every once in a while.
Well, I've been going to physical therapy for probably,
3 years?
3 years for different things. I have a neck issue. I have a knee issue. I have a shoulder issue. So
He's friends with his physical therapist. He goes for the conversation.
Now. Yeah, we're friends now. And I've probably bought him a car. But anyway, the bottom line is that I've been dealing with this for quite a while. Here a while back, it's gotten a little worse, but it was intermittent. It was strange. One day I'd be fine. I could work out. The next day I couldn't.
It was weird.
Yeah, it was so strange. I couldn't figure it out. So we finally got to a point where I had a bit of an emergency. And I was just taking a step here in the house. My knee had not hurt. And it just locked up. My knee was like this. It just would not move. And I kind of grabbed the wall and sat down. And I'm like, KJ, we had a problem. And he comes out. And I sat down and relaxed it and started moving around a bit. And it would move, but it wouldn't straighten out completely.
It would.
It just locked in range of motion anyway.
Yeah.
And I'm like, oh, man. So I thought, what have I done? And we gave it the evening because there was nothing to do. It was in the afternoon. And sure enough, it started swelling. And so KJ's like, yeah, we need to figure out something. So he contacted a friend of ours who had an Achilles heel repair.
Two.
That both of them done.
Yeah.
And referred us to a doctor. And that surgeon gave us the number. I texted the surgeon with concisely what was happening and that I needed an appointment. And the surgeon texted back and said, absolutely, we need to see you soon. Go get an MRI, go to this hospital, do this, and come see me on this date and time. Great.
The quote?
Yeah.
For an MRI from Hospital Rivera. And we also knew what an MRI cost at San Antonio Hospital because our friend had just had one.
Yes.
And so we decided to schedule I just made the appointment at Hospital Rivera because they could do it Monday.
Yeah.
You could get your MRI, and then knowing that your appointment with the surgeon was on Tuesday. Where are we? So we're at Hospital Rivera, up on the pass-through, the cut-off, the cut-through. Because Craig is going to have an MRI on his knee. So I came in here yesterday and went to the imaging side and got a quote, and it was 7,300 pesos, more or less, for an MRI on his knee. They gave me the quote and were able to book an appointment for today. So like less than 24 hours appointment to go in and get his MRI. And now we're here. We've registered and we're here waiting. It was very simple.
We'll share more later.
Yeah.
Okay, so I just had an MRI on my lower half on my knee. Boy, I hate MRIs. The first time I had to have one was for my neck. And I had to end up on taking some pills, happy pills, to make me relax. But this was not much better because they got me up to my chest, and I was like, oh, no. Anyway, so I'm apparently claustrophobic. I have learned this about myself through medical procedures, but we'll find out. We'll get the results, and I have an appointment tomorrow with a doctor at San Antonio Hospital. So one point of clarification in case KJ didn't mention that, this was about 4,300 pesos. The original estimate was 73, but when we got here, it was lower, and I think that's because the doctor referred us to here. So we'll share all of the details as we go and how it works out. We got the MRI, and they sent it over to the doctor. Then we saw the doctor on what?
Tuesday evening.
Tuesday evening.
Yep.
He saw me like at the end of his day at like 6 o'clock. We went in and it was great. He brought me in. He had the MRI results. He looked at it. And what were the findings, KJ?
He was going through the MRI and showing us, and you have a very large foreign body in your knee. And we were like, what's a foreign body? He's like, well, I mean, I won't know till I get in there, but it's more than likely a piece of cartilage that's broken off and in your knee. He also said, oh, and do you see this long pointy thing coming off your femur? Yeah. That's a bone spur. That's got to go. We got to remove that too.
Yeah. So he said, if I've got cartilage damage because of foreign body or a loose body in your knee, there is a chance that we'll have to do a procedure while we're in there, and that involves microfractures in the bone. So you're either going to go into surgery and it's going to be a procedure and you're going to be fine in a week or so, or we're going to have to do microfractures in your femur, which means you're on crutches for 4 weeks.
Non-weight bearing for 4 weeks.
So I went into the surgery not knowing what the heck was going to happen. He scheduled it for that following Friday, told me to stay off of it, keep it iced. So that's what I did. I didn't really have a choice. But my knee was pretty much, again, not locked with moving backwards, but I couldn't straighten it. And it was swelling and it hurt and all of those things. And it got a little better, got a little worse. But knowing there's a foreign body, that made sense then.
Oh, yeah.
Yeah, it did not make sense before. So we kind of went into the whole situation.
Not knowing how he's going to come out.
Not knowing how it was going to come out. That was fun. Happy to report they got in there and it was the lesser of evils.
Yes.
But we'll go through that now. So let's talk about...
Hold on.
First, let's talk about the surgery.
This video is not all about you.
I know, that's what I was going to say.
I suffered.
Okay.
I suffered.
Let's just break this down. KJ was wonderful. He took great care of me. We also had so many people reach out, not only but local friends who stepped in and did things. Thank you. You know who you are. Yes. I do want to call out a couple of names. I know you want to thank Scott.
I've got to thank Scott and Rick. You guys, you kept me sane. Yeah. You were checking in on us daily. And,
ran errands.
And Scott, you went to the grocery store a couple of times for us.
Picked up the dog.
We do the dog thing. Yeah. Amy and Mariana, y'all, you did an OXO run for us because after the surgery, Craig got to where he was craving ice cream. He was craving calcium. I don't like
ice cream.
He doesn't like ice cream, but he was craving calcium. And they graciously went and got some ice cream.
And brought us dinner.
Yes, they had cooked and brought us dinner. So everybody has been all of our friends and everybody here. It's such an amazing support system.
Family back home checking in on me, everything. So we really appreciate that. And lots of nice comments from you guys. So thank you so much. We weren't really able to do as many updates as we wanted to along the way because, well, I was kind of out of it, and we'll talk about that in a minute. But then there was the surgery day. Now, I know what happened up until the point where they wheeled me in.
So how are you doing?
I am in I don't have any medications on me yet. I'm fine.
See?
This is just antibiotic for your stomach.
You doing okay though?
Yeah.
We've seen the surgeon.
Yeah.
And the anesthesiologist.
Yeah.
Yeah. So you're ready?
Ready to go, and what happens.
Okay.
KJ, take it. Run with it. I was out of it.
So we got up early and went down. The surgery was at San Antonio Hospital. It was very good. Everybody was really, really wonderful. We got there and probably like within 5 minutes of us getting there, they're checking him in, and we had to put up a deposit, which is very normal. They charge it to our credit card. Had to put a deposit up and everything, and then
I'm going to interrupt. And don't worry, we're breaking all of this down at the end of the video. You're going to get all of the dollar amounts, all of the steps, everything.
Yeah, but we're going to break down the numbers later.
Yeah.
So they wheel us up to the I think the second floor or something, and put us in a room, and it was a private room. And literally they were like, get this surgical robe on. He went and did that. While he's getting all that on, the surgeon walked in, and hey, good morning, how are you guys doing? And I'm like, oh, everything's fine. He's getting his robe on, and then the surgeon, he goes, so this is a private room. You don't really need a private room. You're only going to be here for a few hours. And we were like, okay, well, this is just where they put us. And he was like, well, I'm going to go talk. He goes, if you're fine being in the day surgery area, it's a big bay, but they have curtains set up and all of that sort of stuff. He's like, it will save you some money. And I was like, oh yeah, absolutely. He's like, okay, I'll be back. So he left. Craig comes out, and I explained to him what was going on. Surgeon comes back in. He said, okay, we're going to move y'all over to the day surgery area. And so we kind of shifted that direction.
Which was just like literally 100
down
feet,
the hall.
maybe.
Well, it was down the hall and down it was just down a different hallway. So, so we get over there, and, the surgeon, basically reiterates what he's planning on doing, and takes me off to the side, and he's got his credit card machine there, and he's like, so this is what's going to happen. I'm going to go ahead and charge you for the surgery and everything. Part of the estimate that we had given you to begin with had the kit for the micro fractures. Mm-hmm. He said, I'm not going to charge that to you right now because I don't know if I'm going to use it. But if after the surgery we had to use it, then I'll charge you for the kit. And we were like, okay, that's great. That's wonderful. And didn't need to do it. So that was fine. And then, we're just sitting over there waiting for a few more minutes. The surgeon walks away, and then somebody else comes over. This young guy comes over, and he introduces himself. He's the anesthesiologist, and he explains what's going to happen. They're going to give Craig a spinal block, which that was not Craig's favorite thing. So he said, we're going to do a spinal block, and he was going to give him some good stuff to make him kind of loopy and all of that.
And I was like, knock me out.
Yeah. And
I really don't want to know what's happening.
And then the anesthesiologist asked for my phone number. And so I gave him my phone number, and he said, so I'm going to call you. We'll go in and administer the anesthesia. We'll call you before surgery. We'll call you about midway through the surgery, and I will call you after it's done. And I was like, oh, okay, wow, that wasn't expecting that. And the surgeon about that time comes in. He's like, yeah, you can hang out here if you want. And I said, well, I'm probably going to go try to find some breakfast. And the surgeon was like, ooh, there's a restaurant right over here next door, and they have the best chilaquiles. And I was like, that's where I'm going. So they wheel Craig off, and I sat there for a few minutes, and then I walked down to go have some breakfast. Mm-hmm. and
I'm being wheeled in. At this time, I'm being wheeled in. They put me on the gurney. They wheeled me in. He asked me what kind of music I like. Talk about the operating room.
Tell them, they wheel you in, and they immediately start doing the anesthesia.
Oh yeah. I mean, I'm in there immediately. They're, hooking up, and they already hooked up an IV and gave me antibiotics and some fluids and such before the surgery. So when they wheeled me in with it, and then they just immediately started injecting some happy juice, as I like to call it, into my IV, and you kind of feel it right away.
So you got the happy juice before they did the spinal?
Yeah.
Okay.
But it was all right about the same time. So then he basically had me set up, and they injected a needle that I was expecting to come out the front into my back, and that was quite painful. I mean, it hurt, made my leg, literally they hit a nerve, I think, and it made my leg twitch. It was intense. For a second, he's like, you're going to feel cold. You're going to feel, these feelings go through you. He told me everything as it went. He's like, this is the worst part. Don't worry about it. And to be honest with you, it wasn't screaming pain. It just was extreme. It felt like he was in my kidney or something. It was horrible. Yeah.
I think that if you're a lady, who has given birth and had a spinal thing,
I'll quit my griping.
I think it was the same thing.
Yeah, I think so.
Yeah.
But everything started going numb and blah, blah, blah. Yeah.
And the happy juice kicked in.
And then they kind of upped the happy juice and had me lay back and started talking to me, and he dialed KJ and said, tell him you're okay. So I'm like, I'm okay.
Hold on. This is where it gets funny. So I'm sitting in the restaurant, and I've just ordered my chilaquiles and everything, and the phone rings, and I don't recognize the phone number, right? But I answer it, and so I answer it, and I hear this, Hi, KJ. And it was him all loopy. He's like, I'm here. They put a needle in my back and it hurt. It hurt so bad, but I'm okay now. Everything is fine. And I can hear the anesthesiologist in the background kind of giggling. And the anesthesiologist took the phone. He's like, so we're about to start the procedure. Everything is going well. We just wanted to let you know. Yeah. And I'm like, thank you very much. Hung up the phone. Made sure I saved the anesthesiologist's phone number in my phone with his name so I'd know who was calling me. Yeah. And they brought my chilaquiles. And I mean, it literally felt like, I'm a slow eater, but it literally felt like I was maybe there for like 10, 15, 20 minutes or so.
It was like 45 minutes.
Eating, well, you got to remember, I had to get there to do this. Yeah. So it felt like 15, 20 minutes later and my phone rings and it's Craig. And he's like, I'm doing okay. I'm fine. And the anesthesiologist says, we're almost done. Things are looking really, really good. I just want to let you know he's fine. Click, done. I get like maybe 2/3 of the way through my chilaquiles and the phone rings again and it's the anesthesiologist. And he's like, okay, we're done with the procedure. Everything went fantastic. The surgeon will meet you back at the hospital. And I'm like, okay, I'll be there as soon as I can. I'm having breakfast. He's like, it'll be a little while. He's in recovery. It'll be a little bit. And I was like, okay. So I finished breakfast real fast, ran over to the hospital and got back up to the area that we had been in. And it had been like maybe 45 minutes, less than an hour. Mm-hmm. And the surgeon comes in and he's got this little plastic cup and he said, do you want to see what I took out of him? And I'm like, whoa. And it was this, I mean, like that big.
Like giant lima bean, fava bean.
I kept telling everybody it looked like a peanut M&M that had been squashed to like 1/4 of an inch thick.
A big peanut M&M.
Peanut M&M. And so the surgeon, he said, if you look at it, he said, you can see it is worn very smooth, like a river stone. He said, that means that's been in his knee for a long time, just turning around, right? Yeah. He said, so he's been in pain with this for a long time.
Yeah. Yeah. So that was KJ's experience.
Well, hold on. I'm not done because you're high.
Well, that's what I was going to say. My experience was somewhere after that first phone call where I said, okay, I'm feeling the happy juice. I'm going to lay down now. I remember waking up in the recovery area.
With me.
Yeah.
Yeah. Well, you went into recovery and then they brought you in. Well, so the surgeon, we had our conversation and all that kind of stuff. And he told me I didn't have to do the microfractures. That's really fantastic. And I sat there for, I think maybe 30 minutes, maybe 45 more. And then they brought you in from the recovery area. Mm-hmm. And they already had the ice pump thing on your knee. It was all set up. The surgeon was there. He was like, he's going to be out of it for a while, but he should be, probably ready to go around noon. And he told me about the ice machine, how to operate it. Said you can get online. There's videos on YouTube about how to take care of it and do all that sort of stuff. And Craig, he kind of woke up. He's like, hi, honey.
Where am I? Who am I? Who are you?
Don't lie to them.
I'm back. I started to get a feeling back in my legs. I do not like the nerve block process. We'll talk about that later. Any of you ladies probably know exactly what I'm talking about. Some of you, and some of the other folks. But yeah, do not like that at all. But
at least the anesthesiologist was hot.
I didn't feel anything. Oh, hi. How are you? No.
Hey, I've got his phone number.
But he was very good. Everybody was so good. Spoke English. Jimmy, whether I spoke Spanish or not. And
it's not that we feel like that's a requirement. It just makes you feel more comfortable.
In a medical setting, sometimes you don't understand everything. And so they would go back and forth, and then they would make sure I understood, which I'm just acknowledging as a going above and beyond.
Yes.
Hold on, I'm not moving because it's taking my blood pressure.
Ooh. He moved the last time I was taking his blood pressure and the alarms went off. because the cuff kind of dislodged a little bit. So let's see, how's it going? You okay? It's taking it. Ooh, it's not looking good, Craig. You're gonna have to live here.
It was 107 over 68 earlier.
Yeah, you were also on a lot of anesthesia. 125.74, that's fine.
125 over 74.
125.74, that's fine. Yeah.
So, yeah, it was very, very good.
So he's got this this cool, literally cool. It's like an ice water thing that is a therapy machine that the surgeon actually got for us to take home.
Yeah.
We have to rent it. We have to pay for it, but he got it for us.
We have to bring it back.
Yeah, we have to take it back to him whenever we do the...
And look, I can move my foot and my leg again.
Yay! Don't move it too high.
Couldn't do anything.
Don't move it too high because there's nothing on underneath there.
I was dead from here down, which was a good thing. So, no, everybody was great. They made me a little woozy during, so I didn't have to panic. And, yeah, everything was great.
And something that was really cool, like it's one of those above and beyond things that Craig and I both experienced in hospital settings here in Guadalajara and Ajijic both. In this particular case, the anesthesiologist came in, met with us before they took him away, and gave me his phone number and said, I'm going to call you before the surgery, during the surgery, and after the surgery. And literally, I mean, he called me right before after they'd given Craig the spinal block and the medicine and everything. He called me and had Craig on the phone, told me he was okay, da-da-da. And then they actually just called me at the end of the surgery because I went out to have breakfast and literally sat down and was starting to eat, and they were calling me going, okay, we're done. I mean, it was like 30 minutes, and so didn't even need to call me in the middle of it. So everything went better than expected, but it's that above and beyond thing that I don't think I'm used to from the U.S. medical system. It was really, really cool. Hold on, motioning. Water. You needy.
He hasn't given me any water yet.
He lied. He thirsty. In more ways than one. I won't get him some water. He's like, I did good. I'm like, yes,
I'm not
you
a
did
mean.
good.
I'm not a mean person when I wake up. That's a nice thing to know.
Yeah, he was very, very sweet, and I just kept telling him it's okay, sleep, And so we were there for an hour or so, and he slept and he dozed off and on and whatnot, and then he woke up and he was a little more coherent. And I'm like, okay, try to wiggle your toes, and so over time he started wiggling his toes and moving his legs, and you could tell when the anesthesia wore off, and by the time he could feel his legs, I'm, touching his legs and doing all that. He's like, yeah, I can feel that and all that kind of stuff. And it was like literally right around noon. And he's like, I think I can walk. And, I told the nurse, I said, I think we're ready to go. And she was like, okay. Off we went. I mean, they come and unplugged him and sent us on the way.
They had an orderly go out with us.
I forgot one thing. One thing. So when they brought you back from recovery, you're on one of those surgical beds, and they have to transfer you over to the bed.
I don't remember that.
Yeah, and God bless them, the two nurses in that area. I'm not sexist or anything like that, but they're women, and they were smaller, younger women, and here they come wheeling him in. They looked at me
and they were like, holy crap.
They did. They look at that. You could see them like pulling the sheet out and how we're going to move him and all that kind of stuff. And I could just see the looks on their faces like, how are we going to make this happen? And so I asked them, like, do you want me to help? And they gotten a third nurse over there, and they were like, I was like, do you want me to help? And they were like, do you mind? I'm like, no, not at all. And so I got on one side of the bed, and they got everything all bunched up, and the nurse across from on the other side of Craig looked at me and she's like, I'm going to count to 3. And then and she goes, and I just want you to slowly pull, and we're just going to slide him over to that other bed. And we did it, and everything was perfectly fine.
That was a long way to say, and I helped.
But it's fun because I want to bring that up just because it was, it just, I don't know. It felt real, right?
Right. There's also so many, it's such a difference here. in Mexico versus the United States, where they're not like, I mean, he goes over there and is like, can I help? And they're like, yeah, slide him over. They're still in control.
Yeah.
But they'll let him help. In the United States, sometimes they're like, no, you can't.
Oh, they would never let you touch. Yeah, because they're so afraid of malpractice and lawsuits and all of this crazy stuff. And they would have let you sit on that bed for hours until they found people who could move you, right?
Exactly. Yeah.
Here, it's like, no, you're fine. You're his husband. You want to move him? Let's move him.
Well, anyway, so then we went back down and they wheeled me downstairs and he did all the final checkouts and payments and all that. And they helped me get into the car. He pulled up and an orderly came out and he's like, you could tell he didn't speak much English, but he's like, hug me. I'm like, okay. So I hugged him and he just lifted me and boom, flopped me down the car.
Yeah.
But then, so I got home and I was able to walk. It wasn't very long until
you were able to hobble over to the bed. Yeah, you kind of hobbled over to the bed and we got you laid down and the machine put back on your knee and all that sort of stuff.
Now, we also did have some accoutrements we'll tell you about.
Go Speed Racer, go Speed Racer. Go Speed Racer, go. Okay, JoJo. Come on. I know you want to come in here. She's very worried about him. All right. I'm gonna sign off on the camera because I gotta help him get all of that put on.
My water kit.
Your water kit. Yes. Okay, hold on. JoJo, you gotta move. You gotta move, little girl. Hold on, I'm there.
So we actually did some preparation. So we had a walker that I bought because I had a family member who was thinking about visiting, and I'd found it at a secondhand store here. And it was only like 300 pesos, like 15, 16 bucks. And I was like, oh my gosh, buy that. You never know when you're going to need one.
Yeah, so apparently we're the people who have a walker now.
So I have a walker. It folds up, it goes in the closet, but hey, I'm ready. But he had also borrowed some crutches.
Shout out to Hudo. Thank you for loaning us crutches.
Thank you very much. We'll get those back to you soon.
Yes.
If we haven't by the time this is out. But that was really helpful. The crutches weren't that great for me. I basically just used the walker.
I think it's I think crutches are like a bicycle. If you use them when you were a kid,
you have that
internal
balance. Yeah.
But at our age, it's one of those, what in the world is this?
Yeah, and thanks to Dr. AI, I Googled or AI'd how to use the crutches appropriately. Yeah. And it did explain that you're supposed to use one side. You use it on the side that's bad. Or no, on the side that's good, not the side that's bad.
Yeah.
So you use it to lean your weight off of it. But
anyway, once your knees started getting better, they actually did come in handy for you to do some...
Just to get around. Yeah. So, anyway, needless to say, I slept a lot that first day.
You slept a lot the first 3-ish days. Yeah. Well, the first 2 days, you slept a lot. And
they had me on some serious medications.
Yeah. And the ice machine thing looked like a cooler that you fill full of ice and had a hose that would circulate cold water and everything. That came from the surgeon. So, I mean, the surgeon actually
loaned it to us.
Well, we had to rent it.
We rented it.
There was a line item for it. But the thing is they're like, there's no point in you buying this. You're going to use it once. So they kind of rent those things out. And so he had it right there at the hospital for your surgery. It was on. We came home and
love that thing. Yeah. Oh my gosh. Anybody who's ever had knee surgery, about the ice cooling therapy thing, and those are wonderful.
Yeah, it was funny because the surgeon was like, so do it 20 minutes, take it off for 2 to 3 hours to give your skin a break and all that kind of stuff. And so we started off trying to do that. And then talking to friends and reading stuff online, everyone was like, put it on and never take it off again.
We just put a towel between it and my skin so that it wouldn't burn the skin.
Yeah, and so we talked to the surgeon at the post-op, and I told him that, and he was like, yeah, he's like, a lot of people who are younger do that, and it's fine. He goes, but if you're older and your skin is thin, if it's really, really cold, it can burn you. Well, I was very careful to make sure that the water was cold, but was not ice frigid.
And I do want to call out one thing. KJ was wonderful. He was in there every 20 minutes. He was making sure I had my pills on time. He just doted on me and made sure I had everything I needed, cooked dinner, did my laundry, everything. I didn't have to do anything. But then I would say probably 2 days in, I started kind of being restless and being like, I can get up now. I want to get up. So I came in and I would prop up on the couch and would watch TV or something. And I'd fall asleep and not see the whole show and that kind of thing. But, but the third day I started being able to get up and move around, and I'm like, this feels really good.
I don't really
move around.
There's not a whole lot of pain. This is good.
I understood don't do that when you don't need to, but if I need to walk into the living room, I'm going to walk into the living room. If I need to go grab myself go to the bathroom, I'll run and go to the bathroom. That was a mistake.
No, I don't know that was really a mistake, because what happened, it felt like a mistake. What happened was on day 4, right, about 3 a.m. in the morning, I'm kind of rustled awake in the middle of the night, and he is curled up in the fetal position crying. And I'm like, what's going on? What's wrong? And he's like, the bone. Oh my God, the bone. There is so much pain. And I'm like, okay, hold on. So, literally got up, turned on lights, all that. I'm like, talk to me, tell me what's going on.
Because you also have to watch for like blood clots and stuff like that. And that can be
talk to me, tell me what's going on. And he was like, it's the bone. And I'm like, your femur. And he's like, yeah. And I'm like, tell me what it feels like. And he was like, you remember whenever you were a young kid and you would go through those rapid growth spurts and your bones would hurt so bad? I'm like, yeah. He's like, multiply that by 10. Mm-hmm. Well, so we start doing some research, and because it's the middle of the night, so we Dr. Google AI, right, and all that kind of stuff. Well, what we found out was the spinal block that he had. Even though after a few hours after the surgery, you're able to feel your legs and you're able to walk and all that sort of stuff, there is still a high level of anesthetization going on that lasts several days.
Yeah.
So in this whole type of a surgery, it's like well documented. You get online, they're like, day 4, the bone pain starts. Because the spinal block is actually worn completely off.
Yeah. So what I technically had was an arthroscopy with debridement and a bone spur removal. And so that was technically what the terms were.
And it was the bone spur removal that was causing the bone pain.
So I AI'd it and said, I know it's not a doctor, but I'm like, what are the expected symptoms and progress? Man, it nailed it to the hour. Like, you're going to have this first day, second day, day 3, day 4, and then you'll be able to do this and you won't be able to, and I mean, that really actually helped us.
It really,
at least know what was happening.
It helped set the expectations for what was going on and alleviated our concern that there was something going horribly wrong. Yeah. So, I mean, as soon as the Farmacia opened up in the morning, I ran down there and I grabbed a bottle of Tramadol and I came back and I'm like, here, M&M's, just start. I'm joking. I'm like,
I took one Tramadol.
I'm like, take this. I'm like, is more.
Okay.
I'm like, here, take this Tramadol.
Apparently he strawed him. He horsed them down my throat.
And it cut the pain enough for him to be able to fall asleep.
Yeah.
Which was fantastic. And then I think that first day he took like 3 Tramadol over the course of the day. We were very careful, about dosages and all that sort of stuff and interactions. And then the next morning you took another one and then you basically kind of stopped taking them.
Yeah.
Yeah.
It knocked the pain and let me sleep. But,
yeah.
I did kind of then about that time, when the bone pain was hitting, I still had some pills, so I was okay. But it was hard to move around, getting up or sitting down. But sometimes it was
being in one position too long really seemed to bother you as well. I mean, like if you were laying down in the bed for more than a couple of hours, that would start causing you more pain. You'd go sit on the couch for a little while. After a couple hours, you couldn't do that anymore.
Yeah. Yeah. So it was miserable for like 3 days. But I will say it slowed down and it started just kind of tapering off every day. Every day I woke up was a little bit better. And fortunately we are now at 14 days? No.
Yeah, because Tuesday was the 12th.
13 days.
No, Tuesday was the 12th, so that was,
I guess it'd be 11 days. The surgery was on a Friday.
Yeah. Okay, yeah, you're right, 13 days.
13 days. So we're at 13 days, and I now I can walk. It does hurt a little bit when I walk. I'm careful. I still put my knee up. I still stay off of it. It feels a little loosey-goosey in there. and I have a scheduled appointment for
It might feel a little bit loosey-goosey in there because you don't have a big old rock in there anymore.
Yeah.
You might have just gotten used to having that thing in there.
Maybe. But I've been scheduled for physical therapy. Thank goodness I have an amazing physical therapist that I already went to for my neck and had been going to for my leg, trying to figure out what was wrong. He had suggested an MRI. I should have listened to him. But I'm starting that tomorrow. So we're going to work on range of motion, etc. There's a 10-week process on that. Which I go anyway, so it's not going to be a big deal.
So we've gone through post-op. So post-op was a day and a half ago. It was on Tuesday, and we walk into the post-op appointment, and Craig, the doctor, Dr. Otto, he was like, how's everything going? And Craig goes, I got a bone to pick with you.
Yeah.
And he's like,
what did I do?
What did I do? And he's like, hop up on the table. And Craig hops up on the table, and he's like, okay, so you told me what was going to happen during the surgery and everything, but what you didn't tell me was day 4, I was going to wake up and have such crazy, intense bone pain. It was absolutely horrible. You didn't warn me about that. And the surgeon looked at him and said, well, you wouldn't have had the surgery if I told you that. And we all just started laughing.
He knew I was messing with him.
Yeah, we were all messing around.
But
he said, no, everything you're describing is very, very normal. And he looked at Craig's knee. He did the range of motion test. And he said, your range of motion is actually better than I anticipated.
He said everything was doing better.
He said your knee is not, the fluid on your knee is almost gone. It's nowhere near what I expected. And the stitches, the incisions look fantastic. And he pulled little stitches out.
I have 2 little bandages here.
Yeah, pulled little stitches out and said, you guys are great.
Yeah. One is like less than an inch and one is like just a centimeter. So those should heal up nicely, I hope. They haven't had any problems with them. They're not swelling, anything. The swelling of my leg has gone down. I'm able to walk. I feel good. And
we see him again. Yeah, we see him again in 4 weeks.
Yeah. So things are going very well. It was an amazingly fluid experience with the doctor and the hospital, and we have all of that information at the end of this video. So we'll break down what the cost is, what the who the doctor was, how to reach them, all of that. I do want to throw in one more thing. They did send me for a obligatory cardiology appointment.
Because you take a very low dose of blood pressure medication. Yeah.
I did all the blood work. In between the MRI and the appointment, we did blood work and saw a cardiologist. So that also needs to play into this whole thing that we didn't really mention.
Oh, yeah, I forgot about that. Yeah, you saw him on Tuesday, and we had a cardio appointment Thursday, and got all that signed off on blood work on. We did the blood work and the cardio, I think, on Thursday.
Same day, yeah. So if you are older than me, or if you are on any kind of blood medication or blood pressure medication, or have some sort of heart issue, they're going to send you to a cardiologist. You're probably used to that in the States. Or in Canada.
Or wherever, yeah. So, I mean, I know we're going to jump into the costs and all that kind of stuff here in a minute, but I have to give a shout out to the surgeon, the anesthesiologist, the nurses and orderlies and everybody at San Antonio Hospital. Everything was so wonderful. Everyone was so kind and fun and funny and lighthearted. It was from, you were all doped up. And it was a great experience.
Yeah.
They made me feel very comfortable.
Can you tell KJ really took ownership of this situation? He's been wonderful. He led me through the whole thing. He took care of me. He coordinated all the stuff that needed to get done and still did some stuff that he needed to get done. But you can tell by he's like, I got this. He's on it. He knows he knows all the details. So I'm really, really want to say thank you to KJ.
Oh,
yeah.
Thank you.
Yeah, because I mean, if the tables were turned, I just don't know if I got it in me. I'm sorry.
I know.
I took care of him when he had his gallbladder surgery. So hopefully I paid it forward. Anyway.
Isn't that what you do when you get married? You promise each other that's what you're going to do. You're like, I don't know which one of us is going to fail first, but
exactly.
It's the gamble, right? It's the gamble and the commitment.
Yeah. So I
should have married healthier.
Hey, talk to my parents. They're the ones with all the joint issues. I will say that I want to say thank you to Dr. Hadro, however you say it, who really took good care of me. The anesthetist, all of those people that took good care of me.
Dr. Franz, the anesthesiologist,
Dr. Franz,
yes.
KJ's got a crush on Dr. Franz.
A little bit.
Sorry, Dr. Franz, if you watch this.
Oh, I think he figured that out.
Yeah, when you went...
The nurses, I didn't get everybody's name. They were all absolutely wonderful. The whole experience there was wonderful. I know that probably a lot of people are going to ask about, is English spoken there? It's hit and miss. I mean, some people do, some people don't. The surgeon, the anesthesiologist, 100% English. The nurses on the floor that we were on, not a lot, but didn't matter. I mean, we speak enough Spanish you can smile and point and you figure things out.
They're
really
very
fast.
good at assessing what your level is, and if you need them to translate, they'll translate it on a phone.
Oh yeah.
Or they'll go get somebody that can speak English.
Yeah. So, language was not a barrier whatsoever.
It was not a barrier.
No.
Yeah. So I'm going to give you the information for the surgeon and for all of the doctors that we saw in the hospitals. And so on the next page you're going to find Hospital Rivera, Hospital San Antonio, Dr. Hector Hadro, the orthopedic surgeon. And I'm going to put my physical therapist in here because he's amazing, Daniel Rosas. And then we also went to a cardiologist, which I will add in here. I'm not looking at that right now, but you will be. Also, we wanted to break down the pricing, which we're just going to let you read that. And we'll break it down into English and Spanish.
Yes. One thing, when you're looking at pricing, I have got to put this disclaimer out there. You may be watching this video 5 years from now. Prices are going to be different. Everyone's surgery, everybody's experience is going to be different. Just because this was what we paid for this procedure, it does not mean that is what you are going to pay for this procedure. Yes. Make sure that this is just kind of to be useful as a guide, a general, this is kind of what, this kind of a thing might cost. But you can't take our video and go into a surgeon and say, hey, that's what you charge them.
And it's going to vary based on what part of Mexico you're in, whether you have some sort of insurance or not. This was out-of-pocket, private healthcare, medical coverage excluded. So we got the bare bones real price of things.
I mean, and that's like consultations with cardiologists, medications, MRI, blah, 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 everything.
Yes.
Everything.
So we'll put the whole prices there for you so you can see it. And if you've had an experience with any kind of surgery in Mexico and you want to share your story, do that down below in the comments.
Please.
Make sure you like, subscribe, follow us, do all those other things. I will tell you that I am doing fine now, better than I expected, and very relieved that was over. I have a new sympathy for anyone who's ever had knee surgery, knee replacement surgery, any kind of bone issues. I have never broken a bone in my life. So this was a whole new layer of pain for me. It's a difference. They're very different.
And all they did was take off a bone spur.
Yeah. So there is a possibility in the future that, there's more damage. It could result in something down the road, but I'm going to be doing PT and getting back to the gym to do very specific exercises that will strengthen my legs and help prolong any kind of knee replacement or anything like that. Fingers crossed.
Hopefully. I don't think I got it in me for a knee replacement.
Anybody out there want to host me and take care of me? We hope you got some benefit out of this and it helps you. If you ever have to have surgery, if you're watching this and you have to have surgery, we wish you well. And if you haven't already,
go find your truly remarkable life. Bye.
Bye-bye.
You make me weak in the knees. I'm done believing you and me. So darling, please fly away with me, and you will see.